Hi, welcome to Health Talk. I'm Kathleen Liberty. I'm the health agent for the town of Webster. And with us today is Robin Johnson, the Victim Services Coordinator for our LUK Crisis Center. And Robin's here to discuss the STEP program. Welcome, Robin.
Hi.
Hi, how are you?
Good.
Good. Robin, walk us through the importance of the STEP program and exactly what is it?
Okay. Well, the STEP program stands for Strengthen, Transition, Empower, and Persevere. And it's a program that offers services to victims of OUI, under the influence crashes.
Oh, okay. And now, who's considered like a primary or secondary victim that participates in the STEP program?
A primary victim would be a person that was driving or was directly involved in the accident. A secondary victim would be a family member or a friend or someone else that knows that person. They don't have to be blood related. So somebody that knows that person and is affected by, the crash and what is affecting the primary victim.
Now, when you say affecting, does this mean that a loved one had passed, it was a fatality, or is it just going through the whole trauma of being in an accident?
It's actually both. We have several people that we have served that have actually lost loved ones in crashes. And then we have some people that, were involved either directly in a crash or they know someone that was, and, they could have been injured, or sometimes, there aren't any physical injuries, but there are a lot of emotional injuries.
Emotional injuries such as, what type of symptoms would?
Well, a lot of times it's pretty much symptoms of anxiety and depression. People being afraid to get in a car again is a pretty normal, pretty normal reaction to that. Some people, if they get anxiety, they're, kind of worried about other family members or whatever, or they're, sometimes there are legal things that they get, worried about, things like that. And then there's depressive symptoms. Some people kind of want to withdraw, or, they have difficulty sleeping or difficulty eating, or they eat too much, or, there are a lot of different symptoms that could appear.
And do those symptoms appear right away, or does it sometimes?
No, and that's one of the important things about the program. It doesn't have to be a recent crash. It can be from years ago, and someone just kind of realizes now that they haven't actually worked through that trauma, or it could be very recent. So it's really, that's one of the good things about the program. It's very individualized.
So it's a support group, but it's still individualized.
Right.
They're two separate things.
Yeah, there are a lot of facets to it. Some people, just need counseling. We do have a support group too that meets once a week, and they do, different kinds of activities, which I can get into in a minute. I'm the STEP coordinator, so I offer services such as like advocacy, maybe help with navigating the legal system. We work closely with the DA's office in Worcester. And so it kind of depends on what the person wants. So sometimes it's help with legal things, it's help with accessing services, our counseling services. We have counselors that are trained in trauma, and we can get counseling right away. It's brief counseling, so we work with the person as well to kind of get them set up with services in their community as well.
Oh, that's great. So they don't have to go to Worcester all the time. They can actually. No,
right now we serve all of central Massachusetts. So Luck has offices in Fitchburg, Worcester, and here in Webster. So the group right now meets in Worcester, but if there were enough people to set up a group in Webster, I could do that at the Webster office. We're really pretty flexible as far as meeting the needs of the community. So.
And I noticed too, you have this is free service. This is a free service.
It is a free service.
And you have transportation for the victims if they had to go from Webster to Worcester.
Right.
I noticed there was a child care voucher.
Right. Yep.
What is that?
It's we offer stipends for child care and for travel reimbursement if they needed to take a taxi or whatever. I should mention that all of these services are free to the victims. It's funded through the Drunk Driving Trust Fund through the Massachusetts Office of Victim Assistance.
Oh, that's terrific.
Yeah.
That's terrific. So how many victims a year does the STEP program service?
Right now, we serve up to 35. We have about 30 right now. We are in the process of applying for another grant you know, the grant cycles kind of go year to year. And in this new cycle, we are applying to get a grant for North and West Middlesex County as well. So if that all goes through, we would serve all of Worcester County and all of North and West Middlesex County as well.
And you think there's a need for that?
Oh, definitely,
yeah.
Definitely, yeah.
I read in the brochure that according to the Department of Transportation, in 2010, there were over 10,000 victims in drunk driving crashes,
Right.
which they averaged out to be 1 every 52 seconds.
Right.
And I was floored by that statistic because we drive to work, we see a crash, we see a crash on the news. Oh, that's too bad, what a terrible thing, but we don't realize the impact on the primary victim, the secondary victim, family and friends are affected by all of this. So it's not just oh, that's too bad, there must have been drunk driving involved.
Right.
There's a lot more to it than that. And that brings me up to another question. You've talked about the primary and secondary victims, but what about the family and friends? Does this really trickle down the emotional end and the legalities to all of this? This does trickle down to family and friends.
Yeah, it does. I mean, just anybody that's in a family or has friends or anything knows that when something affects their family member or their friend, that it kind of affects everybody around them. Yeah. It's important for people to know the signs and symptoms to watch for, because not always, the victim doesn't always realize that they're, exhibiting some depressive symptoms. Lots of times, family or friends kind of talk to them and say, hey, it looks like you're having a hard time, maybe you could use some help. The other problem with this is that for a long time, I think, people call it a drunk driving accident, and the issue with that is that it's not an accident, it's a crime. And when a crime happens to you, you're a victim and you're entitled to services. So I think a lot of people just kind of think, oh, it was an accident, I have to move forward. And it isn't that simple. It's, people have access to services. It's just really important to get the information out there.
Right, it really is. And I noticed too that the STEP program offers victims, in a case of a fatality, they offer 10 easy steps to writing an obituary. How would we know how to do that? That's a great...
Right. Actually, the guidebook for families is something that the support group worked on. Everybody that was in the group kind of compiled a few things that they could have used, and that they thought would have helped them in their situation. So there are guidelines for the obituary. There's guidelines for what to take to the funeral home when you go to the funeral home.
Yeah.
We actually worked in conjunction with 3 of the funeral homes in Worcester area to work together with this. We met with them. They gave us the information of what they would need in that case and everything. Because a lot of times when something happens like that, nobody's thinking straight. They don't really know what to do.
Right.
The guidebooks are available through our office, obviously. They're available through MAD and the other drunk driving trust fund programs that we have in Massachusetts, which are out like in Western Mass. And we can make them available to whoever needs them. So
that's fabulous. Also, the STEP program offers recommended readings for children and adults who are dealing with this type of grief and loss. So how would they obtain these readings?
Well, some of them are online readings, and they can just, the websites are kind of listed in the guidebook. Other ones are, actual books that you could get from the library. If anybody was interested in getting a certain book, they could always contact me and I can figure out a way to get it. So.
That's fabulous too, because I think that that's important. It's one thing to go to the support group, it's another thing to have something on hand every day, waking up and you're feeling bad. You have something to turn to. Right, and
that's the other, like I said, the really good thing about the program is it's individualized, because not everybody needs the same kind of support. So we meet with the person and we work with them to kind of figure out what's going to be most helpful to them. Not everybody's into doing groups, or not everybody's into having counseling. So there isn't any pressure at all. I mean, you participate in the parts of the program that you want to participate in.
Right. Now the support's 24 hours too.
Yes, it is. Luck has a Luck has a crisis line, so anybody that's a client of Luck, you have an 800 number, and we have clinicians on call 24/7. So if it was, you know, after hours or a weekend or holiday or something, and, you know, somebody couldn't get in touch with me or their clinician, they can call the 800 number, and it goes to an answering service, and they connect you either on the phone with a clinician, or a clinician will actually come to the house.
Oh, actually come to the house?
Yes.
They get that type of service. That's
Yes.
fabulous.
Mm-hmm.
That's fabulous. The 800 number is 1-800-579-000.
Right.
Correct? Okay. So, and that, you can actually call that number to get more information about the support group,
Right.
or for a 24-hour
Right, yeah,
services.
that's the main line that goes to the Fitchburg office, and they forward any calls to me. There's also a website, which is www.step.org, and that will come, the emails will come to me too.
That's fabulous.
Yeah.
That's fabulous. You know, it's just too bad that this has to happen.
Mm-hmm.
But I am so glad that I had met with you previously and found out about this program that I think that everybody should know in the community.
Right.
And I didn't know about it, and it really touched me. Also, I read, and I wish we had here today, that some of the victims actually started making a quilt. Or
Yes.
is it the victims that started making a quilt for the loved ones, or friends or families?
It was kind of a mixture. The people that were in the support group came together, and they made a quilt, and each square represents, some of them are family members that were lost, some of them are just people that were kind of touched by this, and you know, they have like maybe their favorite saying on the quilt, or you know, or things like that.
Mm-hmm.
So it's pretty big. It's hanging in the Worcester office, but I should have taken it today, but
Yeah, no, it would have been great.
I thought I was driving here.
Is that, me too. Is that one of the activities that you mentioned?
Yes, yeah, making the quilt was one of the activities. The thing with the support group is that, again, you know, not everybody wants, you know, needs the same kind of thing to kind of recover from this. So, you know, one of the facets of the group is that we work on projects, because lots of times people feel like, you know, working things out like in an artistic way helps them better than just sitting and talking. So we kind of do both. We have activities that, you know, that they can kind of participate in, and then we also do, you know, the support group where we, you know, talk to each other and get support from each other, and there's, you know, I'm there and the clinician is there, and so.
And what other type of activities do they do?
They've done things, they've done other art projects, they've done hanging in our Worcester office in one of the conference rooms are paintings that they worked on. You know, some of them are, you can tell that they're like tributes to a loved one.
Mm-hmm.
Some of them are just kind of getting their feelings out and, you know, working things through that way, so.
Oh, that's great. I think that's another way of support. And just one more question. You're the volunteers who are the part of the support group that support the support group, are they volunteers or are they victims?
They're participants in the STEP program,
Yeah.
so they're either primary or secondary victims. You know, we have had volunteers in the past that, you know, once they kind of work through things and they still want to help out,
Mm-hmm.
they still kind of, you know, come to the group and help out with projects and things.
That's nice.
Yeah.
That's nice. So they never really want
No.
to be. Right. Well, I can't think of anything else to ask you. I think we've covered just about everything, unless, can you think of anything else you might like to
No,
add?
like I said, you know, the most important things that I'd like to get out there is the service to begin with. You know, a lot of people don't know that it exists, and that it's free, and it's funded through the Drunk Driving Trust Fund, and just to give us a call and we can work things out. You know, it's a very individualized program, so.
That's great. And again, it is Robin Johnson, and you can reach her at 1-800-579-000, or you can also go to www.step.org.
Right,
Okay.
or www.luck.org.
Okay, and that will be on the website as well. We'd like to thank you for joining us at Health Talk. Any questions, feel free to call Robin. You can also call myself at the Health Department. I will have these brochures on hand at the Health Department. If you'd like to just come in and pick them up, that'll be fine. And again, thank you for joining us, and thank you, Robin.
Thank you.
All right.